And switch camera. There we go. There we go. Okay, so welcome to Healthology. Good morning, wherever you happen to be. It's a practical perspective on natural living. I'm your host, Portia, and today we're speaking with a holistic dentist. Hi, Teresa. How are you today?
I'm fine. Thank you very much.
Oh, wonderful. Why don't you just go ahead and introduce what you do and how you came to your profession?
Okay, I am a biological dentist, board certified. I became a dentist in 1995. I graduated from dental school. And I practiced regular, everyday dentistry, family practitioner for 17 years. And then, sorry, my nose itches. And then about 6 years ago, I became, I had sort of a paradigm change. And it's not that it was all of a sudden. It was my youngest daughter was born 9 years ago. She was allergic to every single commercial formula out there, and I was unable to breastfeed. And the doctors wanted to put her on some broken down protein formula and reflux medicine. And that did not sit well with me. I was like, I will be damned if I'm going to put my child on the pharmaceutical wagon as a newborn. And I did some research and found a homemade formula made with raw cow's milk. And that was the beginning of my journey. So a little over 9 years ago, my journey towards the more natural path. And I, started growing more organic and more holistic personally with that. When you start making homemade formula from raw cow's milk, you start hanging out with people who are into the more natural stuff, right? So I met this lovely lady through my milk group, and she introduced me to essential oils. And, I just kept growing in my knowledge and my desire to continue to do more and more naturally. And it just got to a point about 3 years into it where I said, okay, I know enough at this point that I no longer want to practice dentistry the way that I have been. I no longer want to do, and I wasn't even at that point, I hadn't done an amalgam since I got out of dental school. But I no longer wanted to practice with that paradigm. I knew that there was better out there. I knew that dentistry, as I practiced it at the time, was very toxic. If it wasn't the mercury, it was the endocrine disruptors from the other stuff. And I was like, okay, I can no longer do this. So I had to make my decision to either quit dentistry, which was not a good idea because I am sole provider for my family. My husband is a stay-at-home daddy. He homeschools our girls. I needed to find a different way. Or the other option was to learn how to marry what I do with what I believe. Mm-hmm. And that was a better option because I got to still be a dentist, which I love my job. So that's why I went down this path. So I went to an IABDM meeting, which is International Academy of Biological and Dental Medicine. My mentor is Dr. William Glaros, and he invited me to this meeting. It was in Houston. He sponsored me 6 years ago. And I went, and there was a lot about the meeting that matched who I was at that time. They had a booth there that was the Weston Price Foundation, and they had they had another few things that I knew I liked. And then they had some stuff because biological dentistry is full of full of stuff that allopathic dentistry does not have. And so they had some of that there, and I was like, okay, these people are cuckoo. But there was a couple of lectures that I listened to that were world changing for me, like 180 degrees paradigm change. And one of them was the Bale-Donine people. So they wrote this book, Brad Bale and Amy Donine wrote this book called Beat the Heart Attack Gene. And it talks about the oral systemic connection. Things like, that they're 50% of all heart attacks are directly caused by active oral infections. 50% of them. 78% of the blood clots from strokes and embolisms have the bacteria in them associated with dead teeth. So when I learned those things, my brain went, whoa, wait, stop, wait, what? And I then, after that IABDM meeting, shortly thereafter, because I was so intrigued, I was like, oh my gosh, I've got to go learn more. So then I went and I took the Bale-Donine preceptorship, which is 17 hours of continuing education, right? Of alphabet soup. These people are the ultimate geeks. Seriously, the ultimate geeks. They're phenomenal. And they have studied so many different things. They're like data miners. They pull out all this data from all of these studies on PubMed and so on and so forth. And they sift out all the bad studies. And then they pull together all the good stuff. And they're like, did you know that this was correlated to this correlated to this correlated to this, and so on, and stuff that I had no idea. So anyway, that was one of my world-changing, holy crap, kind of lectures. And the other one, which did not seem at the time that it would be world-changing, was a lecture by Bill Henderson about healing one's own cancer, natural, holistic cancer healing. And again, that intrigued me because at the time, my dad had just died from cancer. Little did I know that I was going to need that moving forward. But that was where, I stood, was, those, sorry, I'm about to sneeze.
Oh, don't worry about it.
Excuse me. Inconvenient time. But anyway, little did I know how much I was going to need that information moving forward. But that was where I stood then. And so those were just very life-changing, paradigm-changing things. And at the time, I was like, okay, I really need to move forward in this biological dentistry thing. So I just kept learning. And every year I've added something to my repertoire of biological dentistry. So last year it was ozone. We added an ozone generator in my office, and now we do ozone therapy and so on and so forth. This year is all about airways and how you can restore a restricted airway, and therefore not just restore a person's function, like, where it needs to be, but you can actually improve dramatically the quality of their life by giving them the proper tube through which to breathe, because right now people are running around with these very, very small airways, because try to imagine that your tongue is a foot tiger. Okay, my teacher, my teacher in the DNA and science class is Dr. Felix Liel. What an amazing teacher! So he wrote this book called 6 Foot Tiger, 3 Foot Cage. Okay, so try to imagine that your tongue is a 6 foot tiger, right? And try to imagine that the teeth are the cage. Okay, teeth are crowded, then your cage is constricted. Okay, if you have a tongue tie or lip ties, your cage is more constricted. So you've got all these things. If you have had teeth pulled for orthodontic reasons, because there's like an entire generation of people that had 4 bicuspids pulled for orthodontic purposes. Okay, then your cage gets even more constricted. Okay, it looks all nice and straight and pretty if you've had 4 bicuspids pulled, but your tongue doesn't fit. Okay,
Yeah.
where do you think that tiger's butt is going to sit if it can't fit in the cage? It sits in your throat, right? So this entire, like end of last year, beginning of this year, my entire mission has been to learn how to help people grow their airways, because I got to tell you, most people have restricted airways. Grinding, clenching, gritting, those are all functions of a restricted airway. You know, snoring, sleep apnea, all of those things, again, restricted airway. But not everybody has snoring or sleep apnea. But you know of who grind, clench, or grit their teeth. You see what I'm saying?
Okay. Hush. Sorry, child in the background. Focus. Go ahead.
So do you see what I'm saying? How many people do you know of who grind, clench, or grit their teeth? Like the vast majority of people do. And they used to tell us in dental school, they said, well, this is because you're stressed out. It's not. It's because you can't breathe. You know, so just all of these things are like paradigm changes. Every year I learn something new that I'm like, wow, that's really awesome. And I need to incorporate that into my practice and stuff. And it's not that allopathic dentists are bad dentists, you know, it's just that my standard of care is just ever growing. It's not that they're bad. It's that I've just
they lack
information.
information.
Much more. Yeah, they're not encouraged to learn, you know, or to think outside the box. They're encouraged to fit inside of a box. And if we go as professionals, if we go outside of that box, you know, we are potentially frowned upon by our peers, you know, and, you know, we have to be very, very careful not to, not to overstep our bounds. But the thing is virtually everything ties into oral health. Virtually everything in systemic health ties into that. And there's no reason why we shouldn't be helping our patients achieve systemic health by helping them achieve oral health. You know, so it goes together.
Yeah, everything's tied together.
Absolutely.
That's really, I love hearing in-depth stories like that when somebody really understands their journey, because some people are like, well,
You're
them quite sorted it out in their head. So I love hearing in-depth stories like that. Sorry?
I can't hear
Teresa,
you.
are you there?
It's fading out.
Oh, I think that's the connection, because it's been fading in and out on you a bit as well. We could hear you the whole time, but I think it's just Zoom servers. So we'll just have to power through. So if somebody comes to you, what's a common misconception about what kind of work you do?
Common misconceptions is that we're quacks. You know, an awful lot of regular people think that biological dentists are out to kind of sort of trick their patients out of their money, kind of thing. Does that make sense? They think they're there to swindle people. And so it's quite disconcerting, because the last thing that, you know, pretty much every biological dentist I know of wants to do is swindle anybody. We want to help people, and we want to help them in big ways. So that is that you know, that can be disconcerting. Luckily, I have not had that problem with my patients. I have the best patients on the planet. And you know, I've worked very, very hard to earn their trust. So, you know, and we try very hard to make sure that they understand fully that we're trying to give them the absolute best care we can. So
that's wonderful that you've got such an awesome patient base. If you had to go to another professional in your field, what would be red flags for you?
Okay, if I was a patient looking to go to, okay, so if I was a patient looking to go to a holistic dentist, okay, I would want to make sure that they were not just a member of the organizations, the biological dentistry organizations that they belong to, but that they were certified in some way. So for example, the IABDM, which is the one that first got me into biological dentistry, they have a board certifying process that we have to go to. We have to take a test, we have to go through an interview, we have to do case presentations. The idea being they want to know that we are on the same page, as biological dentistry as a whole kind of thing. But they also just, their interest is into making sure that to protect the public, because there are dentists out there who will join these organizations. They never go to a meeting. They never become certified in anything. But they'll advertise themselves as members of these holistic dental associations. And so the unsuspecting public, thinking that they're going to get somebody who's going to do things, perhaps like the SMART protocol, for safe amalgam removal. They think they're going to get that, but they don't have that sort of guarantee. So the IABDM, I'm board certified by them. The IAOMT, which is the International Association of Oral Medicine and Toxicology. I never can remember. I just always remember acronyms. So anyway, the IAOMT put together the SMART protocol, Safe Mercury Amalgam Removal Technique. And they have, they want their dentists to go through SMART certification so that they know that everybody across the board is going to be practicing amalgam removal safely. Because over the years, they have gotten complaints from people who said, well, this person, they got me in, they said they were going to remove my amalgam safely, but they didn't do everything that the protocol said. And rightfully so. I mean, if people are going to advertise safe amalgam removal, they really need to do it safely. They need to not just say they're doing it because they're members of an organization. They need to actually do it. So it makes perfect sense to me that there should be a separate certification for that. And I am certified. Now I'm going through the accreditation process with the IAOMT, because I'm already board certified with IABDM, but they're two different organizations. And I'm interested in making sure that I'm not only board certified and accredited and everything else, but I'm on the up and up. So I want to make sure that I stay there, and not only like become accredited and certified, but that I stay on top of it. And every year I do something more. Does that make sense? So
yeah, that makes full sense.
So with the IAOMT, there's another step, another process called accreditation that I have, that I have to go through. I'm not there yet, but I'm in the process of doing that. Not everybody who's accredited with the IAOMT is SMART certified. And not everybody who's SMART certified is accredited. That doesn't mean that those who aren't accredited aren't doing the SMART protocol. But the thing is that if you become SMART certified, you agree to do the SMART protocol. There's no wheedling your way out of it. There's no talking your way out of it. You're agreeing to do this. It's part of, now obviously there's still going to be people out there who are potentially going to try to get away with doing the minimum amount, you know, but if I were someone who was looking for a biological dentist, someone who was looking for a doctor who is trained to do amalgam removal properly, you know, then I would at the absolute least insist that I was going to insist to go to someone who is SMART certified. That would be like, okay, I don't know if they're going to be holistic in any other way, but if they can at least remove the amalgam safely, that is a good thing. What I really appreciate about the IAOMT that I wish the IABDM had is the IAOMT lists how many meetings the doctors have attended, and they list their SMART certification status. So any member of the public can go to their website and look for a doctor in their area and find out how many meetings this doctor has gone to, and whether or not they are accredited and whether or not they are SMART certified. So that is really phenomenal, because that will tell you if someone's a member, but they're not SMART certified and they're not accredited and they haven't attended any meetings. You know what I mean? I don't know that they're doing things correctly, you know, because it takes commitment to do this job. So a red flag for me would be if I saw a doctor that didn't have any meetings under their belt, that didn't have any accreditation under their belt. They might be a phenomenal allopathic dentist, but you know, this isn't just an advertising agency, you know, and unfortunately there are doctors out there who treat it like, ooh, if I just put my name on there and I belong and I join, that's a source of patients. People are going to look me up and they're going to find me just for that. And I'm going to be able to get a source of patients that way. You know, I wish it weren't like that, but there are, I guess, enough people out there who are going to use it because it's cheap advertising. It's cheaper to advertise that way than it is you know, I think membership is like $500 a year. It's not expensive it's not cheap, but it's also a lot cheaper than, you know, taking out an ad somewhere. $500 a year, technically, you know, that's less than $50 a month. You know?
Yeah, that is cheap. Yeah.
It's cheap advertising. So there are dentists out there who unfortunately are going to use it as a cheap advertising thing. But that's, you know, I'm committed to people's health. I'm committed to helping people do, you know, establish their oral health, you know, so that their systemic health can follow. Because whatever happens here is connected to the rest of the body. Yeah. And if you don't have good oral health, then your systemic health is going to suffer. Do I promise people that they're going to get their systemic health back if we fix their oral problems? Of course not. I can't guarantee anything like that, you know, but you cannot achieve full systemic health if your oral health is crappy. Yeah.
So in the years you've been practicing, are there particular stories that stand out? Maybe they're heartwarming, maybe they're just those pillar moments where you know you were really able to help somebody improve their life.
Well, I've got plenty of them, but I don't know that they're like in any particular, like that they're in biological dentistry or not. I had one patient who came to see me, 20 years ago, you know, and he came in and he had buck teeth, really, really bad, you know, they were bucked. And poor thing, you know, his self-esteem was suffering as a result. So back then, you know, I did some veneers for him, cosmetic dentistry. It's not even biological dentistry. It was just cosmetic, pure and simple. But it was well done. And 20 years later, he still comes in from time to time and thanks me because you know, he found his wife after that. His, you know, he was able to go out on dates. He was able to fall in love. He was able, you know, all because his self-esteem improved.
Mm-hmm.
I have other patients who came to me after I became a biological dentist. I have one who came in because he had done his research and he was convinced that he needed to have his amalgams removed and he needed to have his root canal teeth extracted because he had been diagnosed with colon cancer. And he was determined to beat his cancer. And he had done his research and read the same books that I've read and done the same studying that I've studied, and so on and so forth. And he was like, all right, please take, you know, do this for me. And I'm like, okay, but I can't guarantee you that any of that is going to heal your cancer. But if that's what you want to do, then I will abide by your wishes. So I did. And he came to me about 6 months after we removed the amalgams and the root canals and so on and so forth, and told me that his cancer had gone into remission, that there was no sign of cancer. Right? And so, you know, do I know whether or not my contribution to that helped him? I can't say. But I got to tell you, as I'm a cancer survivor myself, I can tell you right now, nutrition heals and malnutrition can kill. Yep. I know this firsthand myself. So for me, it, you know, that right there was like, oh, wow, you know, because it again, and that was several years ago before my own diagnosis, you know, but he managed to put himself into remission, and it was purely with nutrition and taking care of his oral health and his systemic health. It followed.
That's awesome.
And I have story after story like that. I mean, so many of my patients are able to like reestablish their health systemically once their oral health is under control. It's amazing.
That's awesome. Yeah. Do you, for the average layperson, do you have sort of any recommended learning resources, like maybe websites or blogs or YouTube channels that they could learn for themselves for learning about biological dentistry?
The best resources are through the iabdm.org and iaomt.org. Truthfully, they've got buckets of research on there that, you know, talks about biological dentistry and what it's really like and what to look for and what the red flags are, et cetera, et cetera, et cetera. Because they really are. They're trying to protect the consumer. Mm-hmm. But we don't have, I mean, if a dentist is doing dentistry according to this state board of licensing and so on and so forth, there's nothing that we do that is going to be considered like a failure of standard of care if somebody doesn't remove amalgam safely for our licenses, because they tell us that mercury is safe, right? So do you see what I'm saying? Yeah. So when a dentist doesn't remove, if say, for example, a patient comes to them and they don't remove that amalgam safely, the patient really has no recourse with a state board or something like that because they haven't done anything wrong according to the state board. Mm-hmm. Does that make sense? Yeah. So IABDM and the IAOMT are trying to educate people and to protect their, protect the patients by, asking their doctors to commit to the extra certifications and so on and so forth. Because, if a doctor's willing to commit, they're willing to put their money where their mouth is. Mm-hmm. You know what I mean? Because commitment does cost money. If you have to go to different meetings, if you have to take more continuing education, I mean, it's expensive, it's very expensive. But biological dentistry isn't cheap. Not at all. No. Not for us as doctors either. Like, you know, we pay through the nose for our neat gadgets, and we pay through the nose for our continuing education. It isn't cheap.
Mm-hmm. Well, you get what you pay for right now.
Right?
Yeah. Oh, well. Hopefully it'll be the standard of care, say in 10, 15, 20 years, it'll be closer to being the average norm.
Mm-hmm. It'd be nice. I mean, I'm seeing glimpses of things sort of moving in that direction. You know, it's not, it's certainly not, it's not profession wide, but like, say, for example, it is now by 2020, I believe they're requiring all dental offices in the US to have amalgam separators. You know,
Wow.
that is a new law. That's a new standard, you know, and that doesn't seem like a lot. You know, that seems like, oh, wow, you know, would they really, but that's a huge step forward, because to a degree, they're acknowledging that, well, not to a degree, they are acknowledging that dentistry is the biggest source for mercury pollution in the environment. Mm-hmm. You know, the biggest source, bar none. And as a profession, regardless of the biological dentistry thing, what the allopathic dentists are saying is, well, okay, amalgam is only safe in a person's mouth or in the hazardous materials, hazardous waste. Okay. And so them requiring the amalgam separators is another step forward in saying, well, yes, it's hazardous waste. Okay, folks, if it's hazardous waste, why is it okay to put it in a human mouth? Mm-hmm. Where's the line where it becomes not toxic as soon as it passes our lips?
Somewhere with the magic wand?
Do you see what I'm saying? So it's, there's small glimpses. I'm hoping and I'm hopeful that it will continue to move forward in such a way that it's going to be, you know, protective of people and really, you know, really understand that patients have a right to know what's going in their bodies, and they have a right to say no. They have a right. Patients have a right. It's their body, their choice. Mm-hmm. You know.
That's, yeah, absolutely. My child's losing patience. Let's wrap up before we start having yelling in the background. So do you have a website or blog or any social media channels people can follow your work on? So
my website is just, I don't advertise. I don't have any advertising. My website is just teresamscottdds.com. And honestly, that's even changing. I'm in the process. It's a 10-year-old website. It's not in good shape. So we are going to be holisticdentalalternatives.com. We're not there yet. Or holisticdentalassociates.com, because I bought both of them because I didn't know which one I was going to choose. I know. I'm like, I don't know. I'm weighing them. I'm like, which one's better? This one or this one or this one or this one? So we're still in that process. I'm pretty sure at this point, I think I've settled on holisticdentalassociates.com, but I'm not sure.
What's the point?
Well, no, because I have another idea in my head that I want to maybe create a business, a separate business, but still a business tied to me, that would be holisticdentalalternatives.com. So I'm actually glad that I bought both of them. Yeah, because my instincts are like, I think I'm going to do it this way. But I'm still in flux with that. So I'm not positive. As far as, I mean, my Facebook page looks like a 21-year-old runs it, because she does. You know, and so there's a lot of pictures of birthdays, happy birthday, and anniversaries and stuff like that. There's not a whole lot on there that's like meaty, It's going to be changing. She's started to post some more things there's some neat research that that I find. I pass it on to her, I tag her on it, and so on and so forth. But we're still growing on the social media front. That is a new frontier for me. I've done it these last couple of years. I belong to my mommy's groups because I am a mommy, and if there's any way that I can help, I identify who I am. I say, okay, hi, yes, they've got a dental question. I'm like, okay, I'm a biological dentist. I'm happy to answer your questions, and that's all I've really done. I've not done anything else, but in the last couple of years, my own health journey has been such that I have been encouraged by quite a few people at this point to go public with my story and start writing a blog and start doing more things like that. So I'm in the process of thinking about it. Because I'm an incredibly strong introvert. And so the idea of putting myself out there in such large ways is frightening a little bit, anxiety producing, but at the same token, my everything how things line themselves up and you just know when the universe is telling you that you need to do something. Okay. Everything in my life is like lining up like that. I'm like, okay, fine. Exactly. I'm like, oh, okay, fine. I hear you. So I'm going in that direction mostly because it's happening again and again where people are saying, okay, you need to do this. This is important. You can help more people if you speak up. It's going to happen. It's just not there yet. You'll
get there.
Second interview. Seriously, that's it. You're my second.
Get there. Well, for a second interview, you just aced it. So
I don't know about that, but
you're doing fine. Okay, so we will just say good night then. I said good morning at the beginning, but whatever. Forget it, whatever. Thanks for talking, Teresa. You have a good night.
All right, you too. Bye-bye.
Bye-bye.